Josie Brandon. I'm the CEO of Business Development here at Phoenix Vascular Access, and welcome to our Community Solutions platform. I am so excited today to have our guest that we invited, John Jeffery. He is a Medicare and Medicaid specialist. Hi, John.
Hi, Josie. How are you? It's a pleasure to be with you today, and thank you for having me on board to have a discussion with you.
Oh my goodness, thank you as well. When we first met about 2 years ago, there's just certain people that you meet at certain times, and you can always realize that when you're talking to someone who is extremely knowledgeable and actually cares very deeply. And that's how I felt about you when I met you. We were talking about Medicare and Medicaid and all these things that people really need to know. And so you were the perfect person that I could think of, and I'm so delighted to have you with us today. So thank you as well. So
Thank you.
let's first talk about what is a Medicaid and Medicare specialist? How would you define that for our audience today?
Great question. So in the world of people that have Medicare today, and that's for seniors over 65, and for certain individuals that qualify for Medicare under the age of 65. When you come on to Medicare, it basically is a type of insurance that is available for those people in that demographic. And the Medicaid side of it is when you get assistance from each state's Medicaid program to help them with some of those costs, which could be from assistance with their prescription drugs, even down to their doctor's visits, hospital co-pays, etc. And so what we do is assist those individuals in those realms, whether they have Medicare or whether they have Medicare and or Medicaid.
Okay, so tell me a little bit about your journey. Like, what made you decide to pursue this specific area and focus on? What was it about your particular journey and why you decided to go ahead and do that?
Great question. I think anybody that gets into the medical industry, and whichever facet it is, whether you're a provider, whether you are a nurse or a caregiver, or you even own a group home, it normally comes from the heart. It's not something that we typically do, and unless you're going to be a doctor or nurse, of course, because that's a longer career road. For me personally, I was in a totally different industry, and I went to work with my wife one day, and we went into a skilled nursing home. It was a little before 9 a.m., and it was a skilled nursing home here in the Valley. And we had this meeting with this lovely lady, and she was on Medicaid, and we needed to assist her, or my wife needed to assist her with setting up her medical coverages that would work with the in-facility doctor. And so back in those days, unfortunately, incontinence supplies were not provided to individuals that had Medicaid and had to be paid for out of pocket. And so, unfortunately, this lady had not been able to have had the caregivers come through. And so she was quite embarrassed because she had an incontinence problem. And we had a wonderful meeting with her anyway. And my wife assisted her with her coverages and set up the providers to come in. And like anybody that cares, I walked out of her room and then proceeded to go out of the entrance of the building. And I stopped my wife and said, I feel so sorry for that lady. What can we do to help her? And so my wife said, well, you could become a doctor. She said, but that's 10 years of dedicated work. And I was a little old for that at that period of time, just a little. And then she said, you could be a caregiver, but she said you're way too overqualified in your realm of experience for that particular job, even though she said it is a very, very valuable position and much needed in the facilities. She said, but what you could do is we need trusted and knowledgeable individuals to help seniors with their Medicare and Medicaid options. And I started to read up on it. And decided that would be something that I would be more drawn to, and spent the next now 15 years dedicating my professional life to helping those people with Medicare and Medicaid. And it's been an absolute privilege and an honor to serve them.
Yes, and one of the things that I remember when we first spoke, part of my journey working in business development is um, doing research on the senior community and families that are going through transition with maybe their loved ones who are aging and they don't really know what to do, or they don't understand how to go ahead and help their loved one or even themselves, someone who's stuck. And one of the things that I remember over and over again is these kinds of questions about what is Medicare and how to work with it, or how to work with their plan, or how to work with these facilities in identifying what facility is able to accept them, or things of that nature. I know there's a lot of things that are involved. And for a lot of family members and individuals, it's a very scary place to be when you have a plan that you don't understand, right?
It
So
is.
having somebody to that you can trust to help explain things to you is, I consider it like a guide, a very trustful guide to help you make
Mhm.
the very best decision possible. So that's part of your process, right? So when you're working with somebody, if whether it's a family member or an individual, when they get that plan and they think they understand it, there's like a whole world behind that plan. You help guide them through that plan with that individual, I would assume. How do you go about helping that individual?
There are a lot of key points to helping somebody with their care. It really starts with what we offer is an analysis. So we review a person's current coverage because we need to know where the starting point is. So many people in the Medicare and Medicaid space do not know what they're eligible for. It's just like when we typically buy either a car or our favorite clothes. We just keep driving the car because we get used to it, and we keep wearing the same clothes because they just feel comfortable. And what we don't realize is, especially with medical coverages, is that we don't realize that as we continue to use that coverage for many, many years, that there are changes that come along. There are other offerings. And the number one thing that we run into with Medicare beneficiaries is that the copays for their prescriptions and their medical services can be shrank per se with one of our plan reviews. On average, with somebody that takes numerous prescriptions, we can save them between about $1,000 and $3,000 a year on prescriptions and medical services alone. For a Medicare beneficiary, that's a lot of money, especially for our retirees. So that's just one of the services. We can also, through our analysis, help a person if they need to have for say instance, a doctor that comes to visit them at home. Maybe they are homebound due to a temporary or permanent illness or disability. So we have that ability to help them. Also, we can help navigate our members that are coming on to Medicare. We have individuals that have been working their entire life and they've been covered under an employer plan. And transitioning over to this new world is a time where they need guidance. They need somebody that they can trust. And so we help them with that. Our services are at no cost to our clients. And we also provide continued client support for those people that decide to work with us. And so after the initial assessment is done, we will also review their prescription costs and see if we can find savings there. We'll review their current providers. And again, if they're in an institution, then we want to align their plan with another plan that will work with those providers. And so not only are we saving them money, we're also reviewing their plans for better benefits. We're also coordinating the providers they work with so that they have a nice, smooth transition into new coverage and they can see those valuable doctors. We can also help people that are coming onto Medicare by guiding them where to apply for Medicare. We can also help people. We have Medicaid specialists. So you may have a loved one that is running out of financial resources, and they may also have physical disabilities and even mental disabilities as well, and the family doesn't know where to turn. We have veteran Medicaid specialists that can help guide them through the application into Arizona's Medicaid program. And so that's a very valuable resource. Assistance with guidance into Medicare, assistance with guidance from transitioning from their employer plan into Medicare, what their options are. Maybe they want to keep working. We can help them even save money if they keep working. And I know that sounds funny, but many beneficiaries enroll into all the parts of Medicare, and when they don't actually have to. So they're, in essence, overpaying for their coverage. And we can help guide them to save money, and our services are at no cost. So there's just a few reasons why it's great to work with a consultant like us, and we can help them through the steps, and again, with ongoing client support, all at no cost.
That's one thing that I absolutely remember when we were sharing about what you provide, that it is at no cost. And how many times do family members either try to call either the Medicare or Medicaid office? They might be waiting for a long time, or they'll get someone on the phone and they might be able to handle the people might be able to handle some general questions. But I think the blessing where you really do come in is you kind of have a window of knowledge, not only within those plans, but because you see so many different plans and you have worked with so many different situations, you are guiding or at least informing your clients. I would assume you're guiding them as to giving them the knowledge as to why they would want to make a decision that's in their best interest.
Mhm.
Talk about how you have been able to take away some of the fear from some of these families as far as
Absolutely.
individuals.
That's a great
Give me
question.
a
So
scenario. Give me a scenario, John, of somebody who was, so distraught or confused, and how were you able to help guide them and provide that solution for them?
I will give you two that just immediately spring to mind. We literally have hundreds, and it's hard to remember them all. Our clients are like family to us, but I will give you two scenarios. I met with a lady once, and her husband had recently gone into a skilled nursing facility. He was terminally ill, and his wife was struggling to be able to pay their mortgage because of the types of coverage that they had was quite costly. I think they were, between the two of them, spending about $1,000 a month. And so because the husband had gone into a facility, then the facility was able to put the husband onto Medicaid, which then we were able to eliminate his health care payments by about $500 a month. Then I met with the wife, and at that point, when I went to her home, she was posting on Craigslist to sell their furniture, what
Oh my
furniture she had,
goodness.
because she was still living in the home. And so I sat down and assisted her and lowered her healthcare costs monthly by another $500 a month. So saving them between $800 and $1,000 a month between the two of them. I was able to get them great coverage and assistance because they didn't know that they qualified for extra help. And she was able to save her home. And that is something, to be able to save somebody's home is enough to touch anyone's heart. And so
Absolutely.
that's the first instance. The second instance was I had a call from a lady about 3 or 4 years ago, and she was paying about $400 for a prescription. And she called me and asked me if I could do anything to help her. She was on Social Security, didn't know who to turn to. And when a lot of the time these people, they call just, whether it be Medicare or they call maybe just one health plan, or especially one of the TV ads that you might see, I'm not saying those ads are the way not to go, but you need to work with a local representative that is experienced in this particular area, in our case, Arizona. And so then they have a resource, somebody that they can meet in person if we need to. So this
Yes.
lady, she called us. She was a local lady here in the Valley, and she told me what type of coverage she had, and I needed her prescriptions, her doctors, and we did a plan analysis for her. About 2 months later, after we processed paperwork and helped her onto another plan, we had a phone call and a voice message was left, and this lady stated that she was walking out of her local pharmacy, and she was in tears. You could hear her crying. She called my office and said that she wasn't crying because she was angry, but she was in joy because I helped her lower that prescription to $7 a month.
Oh
That's
my
how
goodness.
that's a
That's
huge difference.
amazing. I mean,
Exactly.
especially, one of the things that I remember as well is it's a very scary time, when you have all these expenses coming up and you're trying to figure out your budgets and you're trying to figure out how to survive from one month to the next and trying to figure out who to really trust, right? Who's going
Correct.
to help you through this? Um, the thing that I want our community to understand is there are solutions available to you. You just have to seek
Mhm.
them out. And obviously, wow. I mean, between the family that you said first was over $900 that you saved
Yes.
for them, and then this next one was for $7. And obviously, just I can't imagine what it's like every day when you're able to see these things. Tell me a little bit about how has it affected your life as well, just being able to help people in different ways.
It's a tear to my eye helping that lady. It really does. It's a sincere tear. When we're able to help somebody, it reminds me of that we should all treat everybody like family. My mother personally is 97 years of age. She lives in England, and my family, my brother and sister, take care of her. I'm not there to help her, and so every time we get to help somebody, or I get to help somebody, my team does, we treat everybody like it's our own loved one. If we could all do that, the world would be a wonderful place. Um, there are many people that are in our industry across the country, and they specialize and say that they are Medicare and Medicaid specialists. And there are also many TV ads out there as well that they make promises that they can help you. Working with a local representative that you can, is here, real in the Valley, and able to help you in person if need be, is a valuable asset. You want somebody that's had years of experience, and also don't be afraid to ask for some references. Ask for a few of that person's clients' names and say, before you help me, do you have anybody that you've worked with that I can give them a call? Also, if the specialist or consultant like myself has a website, then they should have some testimonials on there from people. Check their Google reviews, make sure they have a 5-star review. But most importantly, ask for a few beneficiaries that they've helped in the past so that they can say, did John take great care of you? Was he able to help you? And we do this when we source out other services. Why wouldn't you do that when you're sourcing to have somebody help you with your healthcare coverages? We not only have references from many Medicare and Medicaid beneficiaries, we have thousands of them, but we even work with a lot of the mobile doctor's offices, and they trust us to help their patients in these times of needs. So we have providers, we have Medicare beneficiaries. We also work with the Maricopa County Public Fiduciary's Office, and also private fiduciaries. These are the kinds of references that you need to have confidence that you're working with a trusted professional that's going to do everything they can to help you. And so that's something that we do and we offer if anybody requests those references.
I would imagine too, John, that you could even help, let's say, an elder attorney who is working with a client potentially with their estate and making
Mm-hmm.
decisions. Could you also help them as well, potentially with helping them identify what would be in the best interests of their client in terms of the types of coverage or plans based on that? Is that something you would also help with?
It is. It is something that we also offer. Like with a lot of situations, if you have somebody that just walks into your office and they are offering services, everybody's so busy that it can be hard to schedule to get in to see a doctor or a lawyer. And so we primarily actually have been proud enough to be able to say that our business and our clientele has been based on mostly referrals. But if anybody is watching and they are in those professions, whether you're in an assisted living, whether you're an administrator in a facility, whether you're a doctor, an elder law attorney, or even if you work for a larger company and you have an HR department that then your employees transition over into the Medicare space, don't leave these people to try and find out on their own, because they can get led into a place where they get given incorrect information. If you call a plan specifically, then they're only going to offer you their plans. By working with our team, we will offer you all of the plans that we contract with and help you find a plan that fits your needs, your prescriptions, your providers, and most of all, your lifestyle and your budget. These are all things that need to be taken into consideration. And these questions are typically asked by a professional when we offer our needs analysis. If you're not getting asked those questions, you need to rethink who you're working with and go to somebody that will ask you those questions.
So let me just give you a scenario to see if this is something that would qualify. So let's say I'm an administrator in a healthcare facility. I have a patient or a client who is having we're having challenges with their particular plan, well,
Mm-hmm.
or services or that need to be done. Let's say something a doctor wants to go ahead and do. And they, as an administrator, I look at that and I go, there's a problem with the plan. Are you saying that there is a potential to reach out to you or your team to be able to identify if there's another option that's available to that patient that might help the patient and the healthcare facility?
Absolutely, yes. And it doesn't necessarily mean that there has to be an issue with their plan. We all keep doing the same thing because it works for us. I had a lady that was on a prescription drug plan and she was paying over $100 a month just for the premium for that plan alone. And we reviewed her prescriptions and issued her the option for a plan that saved her over $1,000 a year just on the monthly premium for her prescription. So there's $1,000 there, and then there were savings on the prescriptions. Any facility administrator should know that the best service you can provide to a loved one's family or a resident is an offering of help with their healthcare coverages, just to have an evaluation done to see if there's savings that can be made. Because if that doesn't happen, you're not giving the full array of services that you should be given. Anybody gets the 3 meals a day in a facility, they get a lovely room to stay in, they have the caregivers. And I understand facility administrators are not healthcare professionals in the coverage area. I understand that, but we are. So we have many facilities that we do work with that when they get what's called a new admit, which is a new resident, they reach out to us or they have the family contact us so we can review and evaluate the current coverages and see if there are options that will save them money and offer maybe additional benefits through a plan. Dental is one of the most used additional benefits in the Medicare Advantage prescription drug plan industry. Second to that is what's called over-the-counter offerings, where some plans offer an allowance where you can go into, let's say, maybe a place like Walmart or Walgreens, and you have a quarterly allowance to buy those things like Advil and different over-the-counter items that we typically would pay out of pocket for. What about glasses? I wear reading glasses. When we get older, our eyes deteriorate. We shouldn't be paying for those. So there are plans that offer different amounts available for eyeglasses. And then, of course, there's hearing aids. And so it's not a matter of just going in and selecting a plan just off of the shelf randomly. We look into what is needed by the beneficiary, where their prescriptions are, where their doctors are, and pull out and provide an analysis and a plan option that will hit as many of the wants for that person. In a facility, as an administrator, if you offered that to every single one of your existing and new residents, how do you think your family, or your residents' family, sorry, would think of you? They would think that you are the most wonderful care home administrator and owner there is. So why not?
Absolutely.
People
Yes.
don't do it because they just they either don't know we exist, or if you do know we exist and you're not using us, then it means you don't care. And so hopefully you will care enough, and you have this option to reach out to us, and we are there to help. And again, we do not charge for our services. If we find somebody has great coverage, we will tell them why and explain why they should not change, so they have peace of mind. If they are paying too much for those valuable services, and especially those prescriptions, then we will help them with this. And another thing I want to bring to the attention of the facility owners that are hopefully listening in and watching today.
Yes.
When you have a resident or multiple residents, you are charging them a monthly fee for them to stay at your facility. If they are not on the Arizona Medicaid program, then they are using their personal resources financially to pay your monthly rent. If you help them by lowering their monthly cost through their prescriptions, which is a regular outgoing cost, an expense, sorry, then you are prolonging their savings. And so that they will be able to afford to pay your full rent for many more years to come. So that means by having somebody review their coverages, you're actually keeping more money in your pocket. Do that times that by the amount of residents you have, then over the course of 10 years, that adds up into tens, if not hundreds of thousands of dollars. People need to think that way,
Absolutely.
because they don't.
Wow. That is so amazing. And and also anybody who is maybe in a facility, a loved one, if there's a loved one or themselves, and let's say they don't have somebody that's doing that is introducing them to someone like you. Now they know that that's available to them. They don't have to wait for somebody. They can actually give you a call, and you can guide that individual as far as reviewing their plan and what's available to them, to see what other options might be available to them. One of the things that came up while I was thinking about this is, as we get older, how do we know when it's time to get on Medicare or Medicaid? Like, seriously, like, we're so used to planning, going through life and picking our own insurance, or going, work, being employers or employees, having insurance. At what point should we start thinking about these things? I remember years ago someone talking to me about Medicare A or Medicare B plan and how to know those plans. And I thought, oh my goodness, now that I know you, I know who I'll be calling. So, but seriously, as we age, when is the right time to be able to give you a call, or to learn about this?
Another great question, Josie. It's is something that so many people don't know, and also at the same time leave too late. If you are turning 65 or getting ready to turn 65, I recommend that our clients or potential clients reach out to us between 3 and 6 months prior to the month of their 65th birthday. The reason being is that we then have time to see what type of coverage they have, whether they're with an employer. If they're not getting employer coverage, we can guide them to apply for Medicare through the Social Security Administration. We even have a link that we can send to them in an email, and they can do it all from the comfort of their home. And or we can also give them the address of their local Social Security office, where they can make an appointment and they can apply to get their Medicare parts. There are two basic main Medicare parts. It's A and B. Another thing that we do is we try to keep the explanation of Medicare in a simple fashion, because it is a lot to deal with and try to understand. And when you go to see an attorney, attorneys will not roll off all the different laws that they're trying to help you with. They're just going to say, we're going to help you. This is how we're going to help you. And here are some of the basic details. Otherwise, why would you be hiring them? So we keep it simple. You need to have Medicare A and B to enroll onto a type of Medicare plan. And we can guide you to get those parts. Again, if you're turning 65, then reach out to us between 3 and 6 months prior to the month of your 65th birthday. If you are, let's say you're under disability and you've been on disability for over 24 months, then you may be eligible to apply for Medicare earlier than 65. And so you can reach out to us and we can guide you to see if you're eligible and give you the necessary phone numbers to call so that you can check your eligibility for that. And if you're again a person that is working for a company and you've gone beyond your 65th birthday because they've been providing healthcare coverage for you, and you have now maybe at the age of 70 decided to retire, then again, you need to reach out to us a minimum 3 to 6 months before you plan to retire, because there are things that we need to help you to do so that when you retire and you transition onto your Medicare coverages, you don't miss out that opportunity. Because Medicare does have some pretty strict timelines of when you are eligible to enroll, and also when you are eligible to make plan changes. And so having an expert in the industry that works with all the different plans out there, that understands how Medicare starts, ends, and everything in between, will take a lot of worry off of your shoulders. You can enjoy your day while you have a trusted expert working on your behalf. You can enjoy your time with your family and your friends while we do the work, and then we reach out to you and help you transition through those stages.
Okay, so I just want to make sure I have it right. 3 to 6 months before the age of 65, reach out to someone like you, or reach out to you directly to be guided as far as where they're at. Where am I at this point? Or prior to making any retirement decisions, to reach out to you so that you can be guided as far as what decisions would be in your best interest. And I know, listening to your stories that you shared earlier about saving people, almost $1,000 and in their medications, I mean, that is a significant savings. Someone that does not make that decision to reach out to you can literally be throwing money away or losing an opportunity that they didn't even know existed for them. So am I on the right track with that?
Yes, you are. For anybody that's listening and you are an employee of a company and they're providing you with healthcare benefits, and you are coming up to the age of 65, if you are continuing to work beyond the age of 65, you will have all of your friends and telling you what they think you need to do. It's funny how everybody becomes a Medicare expert. And also, you will be inundated with mail in your letterbox to the point where we call it Medicare madness for our Medicare beneficiaries turning 65. They're saying, JJ, can you help me, please? I'm getting buckets full of notices. And also, even though it's technically illegal in many cases, you're going to be receiving phone calls from people you don't even know. And so it's a really troubling time for people when they transition into Medicare, and everybody seems to be an expert. And so what we do for our clients is we reassure them that we are here, we are local, we are real. We've been doing this for a long time. My wife and I have about 50 years combined experience in the Medicare and Medicaid industry alone. That's just the two of us. We also
Fantastic.
have another team of about 28 other individuals that work as part of our team. We also have Spanish-speaking people that can help our Medicare, Medicaid beneficiaries, which I know is can be a language barrier. But the confusion can be, again, back to the employer status, is that people can be talked into enrolling into a part of Medicare if they continue to work that they don't need. And on average for 2024, that's over $167 a month they may be paying when they don't have to. So before you turn 65, for all the listeners out there, if you are getting ready to continue working beyond your 65th birthday and continue keeping your employer plan, give us a call. Let us help you. Let us save you money. And let us also be there for you when you do retire, because burning money is what we don't like seeing people do. And you will be amazed how many people do it. And it's sad to see people do that. $167 a month. I don't know about you, Josie, but that to me is 2 wonderful dinners with my wife. And I would rather have 2 wonderful dinners with my lovely wife than give it to somebody that doesn't deserve that.
I totally agree. And I just want to let our viewers that are watching us, I say this with such a full heart. John is so true to the core of his being. Like, when he shares his information, you know you're talking to somebody who is an expert at what they're doing. And I mean, John, that's what I love about you, because I see your soul is so real. And that's why we connected. I'm like, this is somebody who really has so many solutions. And I don't think the community is aware of really what's available to them. And on top of that, like you said, it's a no charge opportunity to at least help somebody. If you're in the position to be able to help somebody, why wouldn't you want to do that, right? And so, wow, this is amazing. The savings, the opportunity to just learn and leverage your life or leverage your opportunity with a loved one who is maybe confused or scared. I mean, why would you not want to be able to reach out to somebody who can help you? So now I know they're looking at your background. They see it says Jeffery Insurance. Tell us a little bit, even though it says Jeffery Insurance behind you, you are a Medicare, Medicaid specialist. So they're not calling Medicare, Medicaid. They're calling you directly, or your particular company. Tell us a little bit about that.
Absolutely. Before I answer that question, if I had a nickel for every person that said, I wish I'd met you earlier, I think I would own a small island in the Caribbean. But for those people that are trying to understand how we fit into the industry, I do not work for Medicare. That would mean I work for the federal government. I am licensed in the state of Arizona and a multitude of other states, California, Nevada, Utah, and a few others, to be able to provide healthcare coverage options. And so as a consultant, I don't like to call myself an agent or a broker, because we don't necessarily sell Medicare products. We actually consult to help people find the right coverage to help to guide them along the way. A consultant is somebody that that helps you get something and teaches you why you're getting something. A salesman is somebody that comes in with a speech and has the intention of making you purchase something that they want you to buy. Two totally different things. We turn people away if they have great coverage, because that's what's best for them. And by turning them away, I don't say we won't help you. We're here to help you, and don't be afraid to ask, but for now you're good. And so back to your question, yes, I don't work for Medicare. I'm licensed and federally certified through the Centers for Medicare Services certification system that I have to take annual certifications, and the pass score rate is 90%. So you better be good. And then on top of that, for each carrier that we represent, which means when I say a health carrier, it could be, let's just say, for example, United Healthcare, Cigna, Blue Cross, for example, we have to recertify every year and do product knowledge testing for each one of those plans that they represent. And so as a consultant, we are not only certified and licensed, but we're also knowledgeable to be able to help with that enrollment. The plans that we offer typically have a contract with Medicare, and that's where the difference is. And so when we work for you, which is what we do, then our job is to help find a plan that most fits your needs. And unlike if you call other entities where they may have just one or a few plans which they can offer you, we're going to represent to you our full array of carriers. We currently contract with over 14 different carriers. And I'll bet many of the viewers don't even know that there's 14 out there. And so that being said, then when we work for you, we pull all of the information together, and then we help you through the steps of not only applying for Medicare if you don't have it, but also understanding how that's going to work, the plan benefits of what we propose that will be a good fit for you. And also, if you have an issue, let's say you don't receive your card right away, or you want to change your primary care provider after you've enrolled onto a plan, we can offer you the assistance to be able to either get that done, or we can tell you the right number to call and what to ask for, even down to billing questions, what people do, whether they move from one county or zip code to another, all of the different periods that they can enroll and off of Medicare. These are all key things that you need to have somebody to call. And there's not many types of specialists out there that can give you that whole spectrum of knowledge. And so we're proud to offer those services, again, to our clients at no cost.
I kind of see you as like the GPS of where to go to make sure you take the right turns to get to where you need to be with your particular plan, or the plan that you might have in mind. And you
Yes.
don't want to get lost. You don't want to have a breakdown. You don't want to have any issues. So you want to make sure you go to your specialist who's going to be able to help direct you. And I do agree with that. You know, sometimes when you are just with one particular, let's say you're calling Medicare or Medicaid, again, they're these employees are doing the best they can. They're getting all these calls, and they probably know specifics to the plan. But you're on the outside, you're on the outside being able to see not only that plan, but everything else that might be available to that person. And that's where you can navigate that loved one or that family member or that individual, that administrator, that patient, to be on the right path, to make sure they're making the best decisions, that they're not losing money, and they don't have to be stressed out, because you're guiding them to letting them know what's available to them so that they can have the best decision possible for their healthcare and their future. So
Correct.
I'm just delighted, and I'm so grateful, John, that we were able to meet. And I know we'll have some more podcasts, and we'll have some more meetings. Is there anything else that you think you might want to add that you think would be of value to our audience?
Well, besides my contact information that you might want to share with them at the end
Yeah,
of the
that's going to be on the screen for our it's on the screen right now once we have this up. Yeah.
I would say this, that a lot of the new clients that we come across that call us, we actually get calls from people that say, I changed my plan and I didn't know that this doctor wasn't part of the plan. I wasn't told by whoever it was that helped them. My prescription's not covered. It's very common. And so we try to alleviate those potential problems and get them back onto a plan that is going to work for them. And so another thing I would say is don't stay on your current coverage just because it's working for you, because plan co-pays change from year to year. That each person is on a Medicare plan with a prescription drug coverage or a Medicare Advantage plan, you will receive your annual notice of change letter typically around September. That letter tells you what's different. And so these differences can affect your co-pays and your prescription costs. So it's good to have somebody evaluate your coverage. I would say every 2 to 5 years, depending on your needs. What I mean by your needs is, are you seeing different doctors? Have your prescriptions increased or decreased? And are you living in the same demographic area? Just for a few ideas. Those are the times where you want to have a professional review. And so I would say that is don't leave everything as is. Have your coverage reviewed by a professional periodically, especially one that won't charge you for those services.
That sounds so wonderful. And we're going to have the information already available, but go ahead and let them know how they can get a hold of you.
So you can call my my office at 480-489-2937. My account manager, we're a family-run business, is actually my niece. Her name is Brittany, and so she's been with us for over 7 years. We've trained her hand in hand, shall I say, per se. And so we're here to help you. We're family-run and owned. And then also we have a website, which is www.jeffreyinsurance.com. Jeffrey spelled Jeffery. We have a lovely website there. My personal cell phone is 480-212-2176. Most business owners don't give out their cell phone.
I was going to say, you do want to go to sleep at night, right?
I want to help people. If I'm not helping somebody and somebody is missing out and somebody is not getting the correct advice, then I'm not doing my job correctly. Everybody deserves help. And so, and then also, again, our website, www.jeffreyinsurance.com. And you can also email me at John, John, at jeffreyinsurance.com. Again, Jeffery. So if you can't track me down, then they can always get in touch with you, Josie, and say, where's that English guy?
Absolutely. Yeah, absolutely. We'll have a link available also on our platform to make sure that if they, a direct link so they can get a hold of you. I just want to say thank you on behalf of all of us here at Phoenix Vascular Access. And just, John, you're amazing. You are a man of your truth. And I'm so delighted that I was able to meet you. And I know we'll be doing more of these, but thank you so much for joining us today in our Community Solutions platform. We really, really appreciate it.
You're so welcome. I look forward to maybe helping you down the road where we could maybe delve into some of the types of plans that Medicare offers. And again, keeping it simple for the viewers, we can maybe describe the coverage options, which I'm sure people get a little overwhelmed with, and I'm sure they'd love to know the difference.
Oh, definitely. Thank you so much, John. God bless you and have a great day.
And you. Thank you, Josie. Bye-bye.
Bye-bye.
Phoenix Vascular Access. Call Phoenix Vascular Access.